introduction. Just as well you didn't play me a Britney Spears song, or you'd have been in serious trouble of me breaking out into song. And how on earth do I follow that? Weren't they fantastic? And actually it was very moving, I felt, with the singing, but also with the way that was demonstrated with their acting, showing what it's really like to have ADHD, and in particular, what it's like for young women to have ADHD. So I was pleased to be invited to kind of talk about innovative pathways, because I think that's where we've been, and that's where we've had to, that's been our pathway as healthcare practitioners. Because certainly when I started working with adults in 1994, long time ago now, makes me feel very old, but there wasn't any part. We had to sort of forge it ourselves, and there weren't the assessments, there weren't the treatments, and we've had to sort of take things forward. And I think it's important to remember that it is a pathway. We're all on a pathway, and there is a developmental impact of ADHD. And that was really illustrated very well in the drama just then by St Mary's Catholic College. And I see this as that as they get older, the experiences, the response of other people, everything they experience and everything that happens to them becomes like they carry a bag, and it becomes baggage. And as they get older, more and more goes into that bag, and it becomes heavier and heavier, and it becomes increasingly difficult, and the world becomes increasingly difficult for young people to work within, because they don't have school, so they don't have a place, they don't have a structure, they don't have people so much telling them what to do. They strive to be independent and to do their own thing. Anyone with a teenage daughter or son knows that as a parent, if you tell them to do this, they're going to do that. They want to be independent. What has become very clear, abundantly clear to me in all the work that I've done, is that if we are to prevent that process of the increasing baggage and the bad outcomes, we really need to start intervening here as early as possible, because that's the only hope that we have to improve this, perhaps for many, a negative trajectory. So with adults, we know that a semi-structured interview called the DIVA was developed, and it's been embraced throughout adult mental health to support the assessment and identification of ADHD in adults. What occurred to me a little while ago in talking to clinicians is actually that there wasn't anything to support the assessment of children. And that seemed to be a big gap, because we should have that, because we've been working in that area for a long time. So, working and consulting with lots of colleagues, I developed the ACE, ADHD Child Evaluation, and this is now available for free for downloading. And I'll give you the website address later. It's available in English, French, Dutch, Turkish, Spanish, Catalan, Italian, and Chinese. Actually, I haven't quite got round to putting these ones on the website yet, but I have them and they are coming. And there are other languages that are promised, so it's really being embraced and rolled out across the world. So I wanted to tell you a little bit about ACE. It has a contents page. It gives you the background, symptom ratings, and observational, an area to record observations. And importantly, something that the DIVA with adults omits, and feedback from practitioners working in the DIVA gave me this information that they really want to have something about coexisting problems and disorders to help support them in deciding whether there's a differential diagnosis or what's the comorbidity. And we need to know that, because we know that comorbidity is the rule, not the exception, with young people and adults with ADHD. And then it goes forward into a DSM-5 scoring sheet or an ICD-10 scoring sheet, depending on what you prefer to use. So how this works is that, so this is an example of one symptom. The symptom here is just the child often failed to give close attention to details or make careless errors. And then here it has some information for the assessor that gives them really little some prompts to orient them to think about that symptom. And this is at home, and it says, is it present? If yes, give examples and probe about how it causes impairment at home. And then here at school, and it's again for the same symptom, some prompts about how the symptom may present in school, and then it prompts you to say, well, if you think it's present, give examples and probe how it causes impairment. Because the issue with impairment is absolutely core. You can have the symptom, but if it doesn't cause impairment, then it's not causing a significant problem. So you go through all of the symptoms in this way, and then it comes to this important section about coexisting problems and disorders. And this gives a list of various ones. This is including autistic spectrum disorder, cognitive impairments, speech and language impairments, tics, Tourette's, other developmental disorders, traumatic brain injury, ODD or conduct disorder, interpersonal problems, PTSD, anxiety disorders, obsessive-compulsive disorders, depression, disruptive mood dysregulation, substance misuse, other, and a category for other medical conditions, if we missed anything, and other mental health problems. And so it goes through each one, and it has a prompt to prompt the assessor to be thinking about the characteristics of the presentation of someone with this type of problem. There's an area for notes. And then it's asking you there, has this previously been diagnosed, yes or no? And based on your assessment, do you think further investigation is required as to this potential coexisting condition? So it's not diagnosing, it's not a kiddie SADS where you do a checklist, it's just, it supports the person to think about what they may need to go away and find out a bit more about. Then there's a scoring sheet. This was a challenge because the diagnostic manuals have not been developed to be an algorithm. And of course, so it says everywhere that, that you need to be using clinical judgment, of course, in this as well. But as much as we can, we put together this algorithm. And I was at the World Congress getting feedback. We were sitting at a table similar to this with some colleagues from the States and Canada, and we were chewing the mud over the algorithm for DSM-5. And Tony Rostein suddenly said, well, we really need to speak to Xavier Castellanos because he was on the DSM-5 working group. And I said, oh, here he is, come over and have a look at this. And we were all poring all over this, trying to work out the best way to develop this as an algorithm. So we have DSM-5 and then ICD-10. So the aim is just to support and help people with diagnosing ADHD. And it's clearly being valued and seen to be useful because of how it's been taken up across the world and translated into various different languages. So now we've got to the stage of assessing and identifying children. NICE guidelines told us that for treatment, we need to be giving a comprehensive treatment plan that includes psychological, behavioural, educational advice and interventions. The question then is, a lot of these treatments that are developed have not been developed for ADHD. And those that have been developed for ADHD just focus on symptoms. They don't focus on, all the other problems. They don't focus on those with comorbid anxiety or those with comorbid mood problems, etc. What about those with comorbid substance misuse? So I've been working for many years to develop various psychological treatment programs which have been taken up to various degrees. Some of you will know some of these programs. This is the RAPID program for children 8 to 12 who have ADHD and problem behaviour. It's a group program. I'm currently talking to John Wiley, who are interested in publishing this, and I hope it will be published next year as a book, so it will be much more widely available. This is the R&R2 for ADHD youths and adults, which is for age 13 plus, for young people with ADHD and antisocial behaviour. It's developed by the Cognitive Centre of Canada. And this is the book, the Young Brahman Programme, which is an individual or a group programme for adolescents and adults with ADHD and comorbid problems. So to think about each one in turn, to tell you a little bit about each one, to think first of all about RAPID, which is the child group programme. I developed this really to provide skills and problem-solving techniques to children who are inattentive and to present with behavioural problems at home or at school. I was sitting on the NICE guidelines. I was a guideline development member, and we would be revising all of the treatments for young people and adults, psychological treatments for young people and adults with ADHD. And when it comes to the younger ones, what I kept thinking about is why are there no interventions working directly with the child? I'm not saying that that's the only route, but there must be a way we can reach directly with the child and their parents with a sort of joined up programme. So you've got double the opportunity of improvement. So the idea with RAPID was to provide training and skills to those involved in the child's care to better support and work with these children. Also by including teachers, because this has been piloted and run in schools. It's currently being run in schools in Surrey. So it provides a protocol that will encourage collaboration between agencies involved in the child's care. It's actually run as an after-school club at a couple of schools. And to provide a structured process to support parents to teach their children to transfer the skills learned in the programme into their everyday lives. And we do this by teaching parents to be the child's coach. And that's a really nice sort of model that the parents learn to actually sit down and have some coaching sessions with their child. So it consists of a manual of 9 one-hour group sessions. The children have what's called a workbook. We call it the RAP book, that describes sessions and homework assignments. The parents get a coach guide, and it employs a variety of training techniques. And the parents have to attend various sessions which teach them to be their coach.